I first realized that the procedure was a success when I had went to the movie theater to see a movie. Because in the past, if I would go to the movies and I would sit for 2 to 3 hours, when I would go to stand up, it was so hard to do. My knees would hurt so bad and I couldn't even straighten out my leg all the way. So after having the procedure and recovering, when I went to the first movie that I saw, I could stand up right away without pain and without any issues, and that really was, wow, this is something I haven't been able to do for years. My name is Laurie Panchak, and I am a patient of Dr. Margany at the Vascular Institute of Michigan. Yeah, so I came to the Vascular Institute of Michigan upon referral from my primary care physician. I have a long history in my family of osteoarthritis of the knees. My great-grandmother had both knees replaced, my mom had both knees replaced, my grandmother had both knees replaced, and in my early 30s, I started having knee problems. I'm a nurse and I worked on hard floors for over 22 years, and with that came a lot of pressure and stress to the knee joint, along with having the genetic history. So I went through steroid injections, knowing that long-term steroid use wasn't good for the health of the joint. So then I went to a series of other types of knee injections to add like a synthetic or artificial cushion in there. And that lasted for a while, and I was very happy with that. But then I got to the point where I needed to have those again, and this last time I had those injections done, it didn't make a difference. So that was very disheartening to me. That was upsetting, because here I am 46 years old and I had a big vacation planned with my daughter, cross-country trip. Also was getting married soon, and I didn't want to be in pain. So that's what prompted me to have that talk with my primary care physician about what the next step would be outside of a knee replacement, and she recommended looking into this procedure. So Dr. Margany got me in right away and assessed me, and was a perfect candidate for this procedure because of my age and wanting to have improved quality of life. My pain level was probably between a 5 and a 7 on that 0 to 10 scale. The pain was really that I was experiencing with my knees was inhibiting me from doing the things that I enjoyed. Being active with my Girl Scout troop that I'm a co-leader of. I enjoy horseback riding with my daughter, and that had always been my relaxation, mind clearing that would help me relax. And instead of being able to enjoy the peacefulness of being outside and riding, I was enduring a lot of pain in my knees. And so that was no longer fun for me anymore. It was no longer relaxing to me, and that really impacted my overall mental health and well-being. When I came to the Vascular Institute of Michigan, from the moment I came in, the staff were very friendly, very professional, made me feel welcome. Every person I encountered was able to answer any questions that I had and guide me along the way. I had a very positive experience if I would call and need to make an appointment. Was able to have some flexible scheduling, and it was fairly soon for me to be able to get my first knee done, to have the GAE procedure, and then getting scheduled to have my second knee procedure as well. So I've actually had both of my knees done. So I've had a very great experience. Going in the day of the procedure, actually when I came in, I recognized a couple of the nurses that were going to be involved in my sedation care from being former coworkers of mine. So I knew that I was in good hands getting sedation, that I would be monitored well, and that I had just complete confidence in what they were going to do. My pain has greatly improved. I would say on a scale of 0 to 10, it's probably maybe about a 2. Initially, I would go through and I would have pain, like I said, 5 to 7 prior to procedure, and I was on more than one medication for arthritis and pain management. And since having the procedures done, I have been able to decrease the medication that I was taking. quite a bit. Some of the things that I was not able to enjoy, such as horseback riding with my daughter, I have been able to get back in the saddle and ride, which is extremely relaxing to me, and I enjoy, doing that hobby. So now I have been able to resume taking my horseback riding lessons and having fun with that, doing hikes in the woods, being active with my Girl Scout troop. I was able to enjoy my vacation with my daughter. I enjoyed a long 16-hour drive in the car, and when you have sore knees, that wouldn't have even been possible. So after having this procedure, I was able to make, a long cross-country drive, enjoy a week-long vacation, doing a lot of walking, a lot of activities and things like that. At work, it's improved my work life. Prior to having the procedure, I would dread walking in the hospital. I'm a nurse. I would dread walking, getting up and walking, from one end of the hospital to the other because of the pain. So now I don't have those issues, and I've even had people mention to me, noticing, you're walking a lot faster now. So that's a difference that's been pretty obvious. I would definitely recommend having the GAE procedure. It has improved my quality of life. It has helped my pain. Now, predominantly what I feel is maybe more like some stiffness. And before having this procedure, I couldn't differentiate between pain and stiffness. Everything was pain to me. Now, just have a little bit of stiffness.